You can have all the symptoms in the world, but if you don't know lifestyle, if you don't know how people are operating, if you don't know their family dynamics and stressors they're having, symptoms can be all kinds of different reasons why. It isn't just a sick problem and we're going to put a Band-Aid on top of it. It's let's find out the root cause. Let's get you the help that you need and let's partner together. Doing this business for over a decade has been really interesting to watch it evolve and watch people learn what we do. I remember going to network events or even just, meeting people and oh, what do you do for work? And so I would tell them I'm in the functional medicine space or integrative health. And you can see them glaze over, no idea what that word even means. So they didn't know how to ask the right questions. But then as it kind of progressed through the years, now people are understanding the word functional medicine or integrative health. So that kind of gets them intrigued because it's a familiar word that they've heard before. It's not so new and they don't feel so uncomfortable asking more questions. So I find that really curious as to kind of where things are headed and that people are getting more of that integrative care, that functional medicine care, which I think is so cool. People would ask me more about the questions of the medical side. What I always lean into, because they want to say, oh, are you a doctor? Are you a physician? And how'd you get into this? They're super curious about my story. And so that always made me realize that every interaction with a person is a relationship. It always starts with relationship. They want to know more about me, and then they might want to know and then ask more questions about them or their health or their issues. But what I found is that, and what I really bring into my team is that it's always relationship first. So when a patient, for yourself, if we were to meet and you're asking me what I do and what we do and what does that mean, it's always about asking you back. You're getting to know me just as much as I'm getting to know you. And that transfers into the practice, into every interaction within our business is really getting to know the person on a personal level. You can have all the symptoms in the world, but if you don't know lifestyle, if you don't know how people are operating, if you don't know their family dynamics and stressors they're having, symptoms can be all kinds of different reasons why. To be able to see people and be with them and talk with them and really give them the time is super valuable and super important to what health is and where people want to take their health. Yes, you can go in and get a symptom. You can go to your GP or you can go to the emergency care to get things really dialed in. I need this now. But in our practice, we want to really hone in on some of the key factors, match it with their lifestyle, and then progress it with their goals. If I didn't know much about you and about your lifestyle, and I just knew about some of your symptoms, or the provider knew some of your symptoms, sure, you could slap some things on. But if we're not partnering throughout your treatment plan and throughout time, then we really don't know what's working or what's not working. And I do think with longevity medicine and integrative health, it isn't just a sick problem and we're going to put a Band-Aid on top of it. It's let's find out the root cause. Let's get you the help that you need and let's partner together. Your feedback is just as much as my feedback. Us getting the information from you as the patient, but also us educating you on why this is important. So you're just as invested in learning more and telling us more about oh, I didn't think about that vitamin D level. Oh, that does make sense. And so then they take it home with them and they can bring it back and say, oh, you know what? I actually realized X, Y, Z. So it's always this partnership of sorts to come together and really find out how to help you, but also empower you to get the education you need, but then to be your own advocate in your own health. So I do think it's that combination of both education and information, but it is a relationship. From the time that someone calls the phone to when they enter in the office to when they see the provider, every interaction counts. If we can deliver on that and build that good communication, that trust, it's such a reward for everyone. It's a reward for the person who's interacting with a patient, for that patient who's getting great results. And then again, I believe it ripples into their families, into their communities, and makes a better place for all of us to live when we're all living in healthy bodies. If you know somebody who would benefit from the education and information in this video, please feel free to share it. We'd love to get that information to anybody who needs it.